Annually, 40 million of us provide unpaid care to an elderly or disabled person 18 years or older. While caregiving has its rewards, it also has its challenges, including feeling strained emotionally, physically, or financially. Take care of yourself. The person you care for will benefit too.
Sponsored by AARP. A new law called the CARE Act supports family caregivers. Learn more about the CARE Act at cbschicago.com/caregiving. This is CBS Eye on Health.
Every day in Illinois, more than 1.5 million people care for a family member or other loved one, helping them to live independently at home. These caregivers provide unpaid care valued at $18.5 billion a year. A new law called the CARE Act went into effect in January of this year.
Charles Johnson, an AARP Illinois Executive Council member, explains. Charles, thanks for joining us.
It's a pleasure to be here.
Tell us about the CARE Act.
The CARE Act is a law that helps family caregivers when their loved ones go into the hospital and as they transition home. It provides some basic support and common sense solutions to make their lives easier. That's why AARP Illinois worked with state lawmakers to enact it.
So what are these common sense solutions?
There are three key provisions. The first is the patient now has the opportunity to designate a family caregiver in the medical record when admitted to the hospital. The second is notification. The family caregiver is notified if the loved one is to be discharged home or transferred to another facility. And finally, hospitals must make an effort to train family caregivers on the medical tasks that they'll need to perform at home.
Why is it important to support family caregivers with a law like this?
Family caregiving is a labor of love, but it can also be overwhelming, stressful, and exhausting. That's why we're fighting for common sense solutions like the CARE Act.
Sponsored by AARP. Learn more about the CARE Act at cbschicago.com/caregiving.